Hi, it's your favorite OBGYN again. Today we're going to talk about reproductive organs cancers, how to diagnose it, what to watch for it, and what we can do to prevent it. There are four major organs for reproduction. One is the ovary, one is the uterus, one is the cervix, and one is the vagina and the vulva area. And each one can have its own cancer. So when someone says, my family, we had uterine cancer or some kind of cancer, they don't know specifically what it is. Because a lot of time people confuse this. They think that ovary might be part of uterus or part of cervix. So the first one we're going to talk about is ovarian cancer. Ovarian cancer can run in the families. There is a gene for it, and there is a specific blood test can be done to diagnose it. Usually these women, they have bloatings, or they have constipations, or increased abdominal girth, falling pressure. That's when already end stage cancer. The early ones can be diagnosed by ultrasound, usually ovarian cyst that you can see, or a tumor in the ovary. And these ovarian cysts or tumors have a specific sign that shows that it might be cancerous, such as free fluid in the abdomen, or there are certain markers on the blood, and obviously for treatment you need surgery. There's also sometimes precancerous cells that can be also diagnosed, such as by this test. The next one is uterine cancer. That's cancer of the body of the uterus. Again, there are different kind of cancer, but main part of this kind of cancer is irregular bleedings, or postmenopausal bleeding is a sign of it. If somebody has any of these signs, usually we do biopsy or workup, and that's how you diagnose it, by biopsy. Third one is a cervical cancer, which is usually diagnosed by pap smear. And by pap smear you can also get a diagnosis of precancerous cells. It does not run in the family, but it's most of the time caused by HPV, human papillomavirus. The last kind of cancer is a vulvar cancer, which is usually outside of the vagina. It's diagnosed usually in older women. The signs are discoloration and itching. Sometimes you see a lesion in there. It needs to be diagnosed by a biopsy, and a lot of time I diagnose this before they become cancer, when they're precancerous, and by resection of the area you can cure this abnormality.